find out the latest trends in plastic surgery and how things have really changed over the past 20 years. We decided to invite Dr. David Whiteman of Southern Plastic Surgery to come on the show. Now, he's a double board certified plastic surgeon who has been in practice for over 20 years. And we're thrilled because we asked some of you to give us your burning questions about maybe a procedure you want to have done. And Dr. Whiteman is here now with more. Thank you for being here.
Thanks for having me.
It is a pleasure to meet you. And I know over 20 years, you have seen a lot of changes in terms of the technology and what we're able to do. So what accounts for the trends that you've seen, especially as we're getting into these last few years?
Sure. Well, I think there's two things that account for the change. Number one is, I think, acceptability. You know, 20, 30, 40 years ago, it was a bit kind of only for a certain group of people.
Yeah, true.
And what's also changed is affordability. I think that most people think that things are very expensive, whereas in fact the prices are actually quite reasonable.
Right, right. So you have people that are now not being so hush-hush about it. We're thinking, hey, I want to grasp onto my youth in a natural-looking way.
Sure.
And if it's affordable, why not?
Sure, and you know, like the people who are aging and want to stay in a competitive job market, it's a great way to do so.
Right, and talk about really the changes that you've seen since you started.
Well, I think the biggest change has been the idea of rapid recovery.
Yes.
That's been helped by technology, and technology is good and bad. We have companies that are developing products that are very helpful to limit recovery time, to limit scar length, and to improve the rapid recovery. On the other hand, you have to be careful because not everything is as good as advertised.
Exactly, and I know we have some befores, and we're looking at the dramatic changes. So let's say, is this just a traditional tummy tuck?
Well,
for lipo too as well?
You know, traditional is a difficult word because tummy tucks have evolved. So we went from doing a tummy tuck which just involved removal of skin, and now we always tighten muscle.
Right.
We always do liposuction, and now I'm working on a technique that actually advances muscle fascia or the underlying tissue to help actually involve and to narrow the waist. And
Doctor, that is incredible. Look at the difference there.
Thank you.
So you're tucking, you're toning, you're tightening. It's
right.
kind of all in one, like you said. It's definitely not traditional by any means in terms of what you were doing 20 years ago. And by the way, what was the downtime back then for that kind of a procedure?
Well, I would say now the downtime for a tummy tuck is anywhere from 10 to 14 days.
Okay.
But other procedures, things like eye lifts, face lifts, these recoveries are as short as a week.
That's incredible, right? I mean, just to think that now you can just take a few days off of work,
right.
come back, and of course, it depends on the procedure because you know you may not be able to exercise or things like that. But as far as getting back to work and getting back to being a mom and doing the important things in your life, you can do it.
Absolutely. Driving in a matter of 4 or 5 days, walking immediately, and even light gym at 2 weeks.
Oh, wow. Light gym? Okay, excellent. And now, let's back up a minute.
Sure.
What do we need to know when we're looking to find that perfect doctor for what we really want, what our needs are?
Well, that's a very important question because we're kind of a bit of a buyer beware market.
Yes.
So the first thing you want to make sure is that the surgeon that you're talking to was trained in a plastic surgery specialty, a dermatology specialty, and not kind of in a specialty that maybe is a bit quasi-medical.
Right.
And the second thing you want to do is go in and talk in person, because if the doctor's not willing to give you the time and explain their experience and as well complications,
right, right.
You're probably not in the right place.
Exactly, and I know I've heard before, I don't know how prevalent it still is, but I used to hear people saying, you know what, I'm gonna do that, they do the best such and such in Germany, or they do the best in Mexico. What do you think about people going out of the country? Surely we don't need to do that anymore with our wonderful physicians here in our own country.
Sure, people usually go out of the country for price, and what I tell patients is, don't make a short-term money decision about a long-term life decision.
Great way to put it. That's so important. And I know another hot topic that you were talking about in the very beginning is this idea of non-surgical.
Right.
So that seems to be just the buzz expression. We have people that come on the show, you know, hey, you can do this, it's non-surgical, it's going to tighten, it's going to lift. Talk to me about that and kind of the trend in that direction.
There's no question that there's been an evolution in non-surgical treatments so that we are able to achieve some tightening. We're able to achieve some changes. I think the thing that's important here is go in and talk, what's reality? What can really happen? And if it doesn't happen, what shall we do about it? They're absolutely, every day we're being bombarded with new and new treatments.
Right.
So we have to be careful about those that we authorize, those that we support. But absolutely it's the way it's going.
Right, right. And I know we want to get to your burning viewer questions. So let's put up our very first question for the doctor and see what he has to say. I can't afford plastic surgery, what we were talking about, but I really wanted to get that mommy makeover. What does that involve?
Well, a typical mommy makeover involves breast and body changes. We're going to undo the little gift that your children gave you. Right. And the affording side of it, you know, kind of goes both ways. It's not nearly as expensive as most people think. Many offices provide credit options.
Right.
And I think that before you decide you can't afford it, go in and talk. You can break things down. You don't have to have, I think you just had a segment about food. You don't have to talk about having the appetizer, the main course, and the dessert.
Right.
Maybe you just need the main course.
Right. Great point. Great point. Okay, second question is, are breast implants safe? Now, I think the reason this is even being asked still is because a long time ago, the silicone implants were pulled off the market, but they have been deemed completely safe, right? For how many years now?
That is correct. Oh, it's been over 5 years.
Right.
And the reality is they were really only held off as a moratorium in our country. Other countries in the world, Canada, Switzerland, all over Europe, the implants were held back for about 6 months, and then they were brought back on the market. Realistically, there's no data that significantly supports that implants are in any way harmful to your health.
Okay, wonderful. Great news there if you're considering that. And I think we have time for one more question, Brian. No, that's it. Shoot.
Oh.
Doctor, thank you. I know I was getting on a roll here. We could do a whole hour about this, believe me.
Well, I'd love to come back
interest.
if you have more questions. I'd be happy to take questions, you know, on another segment.
Yeah, absolutely, and we could do it on social media as well. So thank you, Dr. Whiteman. Appreciate your time. Great tips and advice. And if you would like to contact Southern Plastic Surgery, please give them a call at 770-622-9100 or log on to southernplasticsurgery.com. And this segment was paid for by Southern Plastic Surgery.